Or I was what I'd say is an uninformed consumer, which again, many of us are. Mm-hmm. I did believe that if you had a recognizable logo on your insurance card, a Blue Cross, a United, Anthem, Aetna, Cigna, any of those brand names, I thought if you had that, you had good insurance. And I also thought that any one of those insurance cards was effectively a discount card, that when I presented that at the doctor's office, I thought I was getting the best pricing. Well, I've spent the last 3 to 4 years studying the industry and have learned that is absolutely not true. In fact, the opposite is true. When you put your insurance card down at the doctor's office, typically what you're getting is the worst pricing that you can get. And the dirty little secret in the healthcare space is you actually can typically get a better price if you just say, "Can I have your cash price?"
Welcome to the Prairie Health and Wellness Podcast, or the PHW podcast. I am really, really excited about today's guest. His name is Dean Jargo. I've known Dean for a very long time. Very close personal friend of our family, personal friend of mine, very helpful in advising me in the various business pursuits that I've had. And so when we talked to Dean about doing this podcast, my mind just really started racing about all the things that we could cover. And I'm sure we're going to run out of time, but I just want to introduce Dean Jargo. Dean, you started at Arthur Andersen, which some people may not know. It's a prominent accounting and consulting firm. You were a senior manager there. You then went on to work briefly at one of the big four accounting firms, KPMG, which specializes in mergers and acquisitions, before you landed at Koch Industries, which we in Wichita, Kansas are very familiar with Koch. Koch is a global conglomerate involved in everything from energy to manufacturing. While at Koch, you rose to the director of corporate financing, overseeing corporate investments and financial strategies, and then eventually a CFO within Koch at Invista, which is their textiles division. Then you went back to Koch Industries as a director focusing on investment opportunities and acquisitions. You then started working directly with the Koch family, with Elizabeth Koch and her company as COO and CFO of 1888, which is a multi-billion-dollar investment portfolio with really interesting investments. I think you guys invested in Rick Doblin's work on psychedelics, and then you were telling me about some research looking into consciousness and brain research. So it's really fascinating things, which brings you to where you are today, currently as CEO and president at Fair Market Health. So welcome to the podcast.
Thanks for having me. You wore me out with that.
Well, I think I probably could have gone into more detail. I remember sitting down with you. I think we were at a barbecue joint, and I said, I knew you'd worked at Koch, and I knew you were higher up in the organization. But I asked you one day, I was like, what exactly do you do? And you were like, well, I'm responsible for about $4 billion of investment. And that blew my mind. I mean, that is crazy. But the more I got to know you and understand your background, it made a lot of sense. So today we're talking about, I think we wanted to call this Resources for the Empowered Healthcare Consumer. So tell our listeners and viewers a little bit about Fair Market Health, and more importantly, I'm really interested in hearing, given your extensive experience in mergers and acquisitions, and your background, the way you described it is you kiss a lot of frogs to find the prince, mm-hmm. And I think that's such a great way to say that you're really good at looking at opportunities out there and finding out which ones are going to succeed. So tell me about Fair Market Health and what made you excited about starting this company.
Well, the easiest way to describe Fair Market Health is really to describe it as an Amazon for healthcare services, because most people are obviously familiar with Amazon, have used Amazon. We're similar to Amazon in that we're an online marketplace, and basically what we do is we connect buyers and sellers of healthcare services. And on the supply side, that really means doctors, surgery centers, mental health professionals, physical therapists, anybody who provides a healthcare service. That's the supply side of our marketplace. And then on the buy side of our marketplace, we serve two main customers. One is any individual who's looking for a healthcare service. So regardless of what you use for your insurance, if you need a healthcare service, an MRI, a surgery, a mental health visit, you can come visit fairmarkethealth.com and you can buy that service. And what's unique about what we do ultimately is we disclose the price of all the services up front, because anybody who's ever interacted with the healthcare service or system knows that you don't get to find out the price up front. You find out after the fact. And unfortunately, after the fact, you have no ability to impact that price. And so we disclose the price up front so you know exactly what you're going to pay. So as individual consumers, you can use Fair Market Health, but our other customer group is self-insured employers. So any employer who sponsors an employee health plan can use Fair Market Health as a way to what I call direct purchase healthcare services, because most businesses hire an insurance company and they use the insurance so-called network to acquire healthcare services for their employees. And that can be an okay way to get services. But again, when you buy services that way, you don't know any of the prices until after the fact. And what we bring to employers is the ability to have transparent pricing for their employees. And the reality is when you buy directly from a healthcare provider instead of through an insurance company, you save significantly. And typically the numbers we see are 25 to 50% savings by buying directly through Fair Market Health with a healthcare provider versus going through an insurance network.
So I think it's interesting when you in your experience with all your other employment, have you ever seen an industry where you would buy something and not know what the price would be? Does that happen in any other industries?
No.
So what?
Of course not.
So I'm sure you've learned a lot about the healthcare industry, and probably a lot of it surprises you. Now, being a physician, I've sort of taken a lot of things for granted that happen in the health insurance industry. But I mean, one thing that really surprises me is that people ask me all the time, well, how much is this going to cost? And I have to look at them and go, I don't know.
Right.
And they'll usually say, well, I have really good insurance.
Right.
So tell me, what is the definition of really good insurance? And where are most consumers, I don't want to say misled, but maybe unaware about what insurance is actually doing for them?
Right. So, and I had to learn all of this myself because I didn't know this either. I was what I'd say is an uninformed consumer, which again, many of us are. Mm-hmm. I did believe that if you had a recognizable logo on your insurance card, a Blue Cross, a United, Anthem, Aetna, Cigna, any of those brand names, I thought if you had that, you had good insurance. And I also thought that any one of those insurance cards was effectively a discount card, that when I presented that at the doctor's office, I thought I was getting the best pricing. Well, I spent the last 3 to 4 years studying the industry and have learned that is absolutely not true. In fact, the opposite is true. When you put your insurance card down at the doctor's office, typically what you're getting is the worst pricing that you can get. And the dirty little secret in the healthcare space is you actually can typically get a better price if you just say, can I have your cash price? Not the insurance negotiated rate, but the cash price. And when you do that, you'll actually save typically 25 to 50%. So good insurance is a lie, it's a fallacy, and we've all been led to believe that good insurance is getting you a good deal on your healthcare pricing.
So for that good insurance card that gives you access to more expensive pricing, hopefully, at least that good insurance card doesn't cost you anything, right? I mean, premiums now are really low for insurance.
Right, exactly. Well, and that's part of why people want to use their insurance. It's a very natural thing because they've paid so much in premiums. Mentally, you're like, well, I gave them all of this money. I need to use my insurance because I gave them all this premium dollars. They are supposed to return to me value by better pricing. But the reality is that's not how it works.
Yeah, I think you taught me the term sunk cost fallacy.
Yeah.
Where you, and when you see this in a lot of industries where you feel like we've invested so much in this, we've got to continue doing it.
Yeah.
And I think that's exactly what people say. In fact, I've heard people say, well, if I meet my deductible, then it's covered at, so this, a lot of people don't understand. So when you're paying your premium or your employer, usually a patient has some part of that premium that they pay nowadays.
Yeah.
That plan then decides what your deductible is. So talk a little bit about deductibles, co-insurance, copay. All of those things, I think, just add even more confusion to how people use their insurance.
For sure. In fact, I don't remember the statistics, but there's statistics out that talk about how many employees or plan members understand how their insurance actually works and the math that goes behind deductibles, co-pays, co-insurance. It's all very confusing, and people are, in fact, confused because when you ask them to explain back to you how does your deductible work and do you understand what co-insurance is, most people, and I'm talking like 95% of people, cannot accurately describe how their health plan and their insurance actually works. And if you don't understand how it works, of course, you're not going to be able to be a very smart consumer. And I'm personally convinced that insurance companies like it that way. They design the system to be confusing so people are not able to adequately and appropriately navigate the insurance system.
Yeah, we like to say the complexity is a feature, not a bug.
100%.
So tell me if I have this correct. This is how I describe it to patients. So if I've had somebody who needs to get a colonoscopy, let's say they've had some bleeding and we want to make sure that they don't have a cancer growing. When you go get a colonoscopy, what are you exactly paying for? Because that's another thing I think a lot of patients don't understand.
Right.
So what are the things that are involved with just getting a colonoscopy, something that most people over age 50 are familiar with?
Right. So when you get a colonoscopy, there's typically 4 things that you're really buying. The first thing you're buying is the physician's time, the person who's actually going to perform the procedure. You're buying the time of the anesthesiologist. You're buying time in the facility, so all the equipment and supplies, where the procedure will be performed, and then the last thing you're paying for is the lab, because typically there's a specimen or a sample that needs to be analyzed. You're buying all 4 of those things, and typically all 4 of those things are separate legal entities. The doctor is a separate legal entity, the facility, the anesthesiologist, the lab, they're all 4 separate, which is why when you use your insurance, you typically get what they call explanations of benefits and invoices from all 4 of those different places. And that's part of the confusion, right? As a patient, you get these bills rolling in. You're like, wait a minute, didn't I already pay this? And well, you paid the physician's for the physician's time, but you didn't pay for the anesthesiologist, or you paid the anesthesiologist, but you haven't yet paid for the facility or the lab. And so it's very, very confusing to people.
So when the colonoscopy is finished, talk about what happens at the back office of each of these legal entities, these separate entities.
I've heard stories, and these are not uncommon, of people getting bills related to especially surgical procedures that are months after the procedure. I mean, you've almost forgot that you even had the procedure. It happens actually a lot in the maternity space. After having a baby, I've heard people getting bills from a baby that was born a year ago, celebrating their first birthday, and the parents are still getting new bills showing up. So it's a very slow process. And again, partly by design by the insurance company, because you've paid your premiums into the insurance company. Well, what do they want to do? They want to hold on to your money as long as they can. And it's one of the frustrations that doctors talk about all the time of quote unquote billing insurance, right? They performed a service and they're trying to get paid by the insurance company. The insurance company has your money. They have your premiums. They should be paying for the services that were delivered on your behalf. But but they want to hang on to the money. So there's this fight that takes place between physicians and insurance companies.
So I think a lot of people don't understand that this change where the insurance company used to be interested in keeping prices under control for their beneficiaries, and it's the reason we have networks, as networks where, you know, you'd get certain doctors in who would agree to give you a better price, and then the insurance company would funnel more patients to those doctors. A lot of people don't understand that with the Affordable Care Act, there was a fundamental change in how insurance companies behaved.
Yeah.
So before, an insurance company would make money based on how much they, you know, could claw back some of that payment that they sent to physicians. So Obamacare said, well, we want to decrease how much insurance companies are making. They're making too much. And so they said, you can only make your profit is a percentage of the premiums that you collect. So they fixed that.
Yep.
But then said, and the only way that you can raise the price of premiums is if the cost of healthcare goes up. And my now looking back at this, I have to wonder, how did they not understand that insurance companies are often the ones that negotiate those prices and get to decide what a service like a colonoscopy is paid for? So how has that, if the goal of that government intervention was to decrease the profits of the insurance companies, talk to me about how much insurance companies are suffering now under Obamacare.
Yeah. So this is a perfect example of, I'll give politicians the credit and say they were maybe trying to do a good thing, but as is typical with government interventions, they don't think about the second or third order effects of the policies that they implement. And this is a perfect example of that, because if they thought they were going to be, reining in insurance company profits, boy, did they get that one wrong. Because now through the Obamacare legislation, they have basically created an incentive, as you said, for insurance companies to raise prices. Because if you fix somebody's profit margin as a percentage, which is what Obamacare did through the provision called the minimum loss ratio, or MLR, when you fix a company's profit percentage, you are driving an incentive for them to make the pie bigger. And in the case of insurance, the pie is the premiums that they charge and the costs that they pay out as claims. And if you look at the last 10 plus years since Obamacare was passed, that is exactly what has happened. And if you look specifically at United Healthcare as kind of the poster child of these insurance companies, because most of them are public, you can see the results. United Healthcare, which I think is the fifth largest company, U.S. company by market cap or thereabouts, their profit over the last 10 or 15 years since Obamacare, their profit and their stock price has been a hockey stick up and to the right. I mean, it's basically pointing straight up right now. And we, of course, as consumers are all feeling the impact of that. And it's not, by the way, it's not just United Healthcare. They're the largest by far. But, you can go look at any of the other insurance companies and they're experiencing the same thing. They get to control because they're so-called negotiating on our behalf. But when a healthcare provider or a large health system asks for a 10 or 15% increase in prices, the insurance company pre-Obamacare used to say, whoa, no. Now they say, are you sure you don't want any more than that? And that's the world we're living in today.
And to be fair, I think Obamacare, there are some things that I really like about the Affordable Care Act. The pre-existing condition, I think, was a really important change that happened. So it might be, again, I don't want to blame politicians for short-sightedness. I don't think there was malicious intent, but I was surprised when Obamacare was being floated out there that insurance companies seemed to be very quick to get on board with it. There wasn't much pushback. Right. And it felt a little bit like, what's the rabbit who says, "Oh, please don't throw me in the briar patch"?
Is that Peter? I don't know.
I think it's basically, I think it's a fable that maybe one of Aesop's fables where the rabbit wanted to be in the briar patch,
right?
And then is all the while saying, "Please don't do that to me." The insurance companies have massively gained from the Affordable Care Act, which was an attempt to really clamp down on that industry. So again, going back to we've got our patient who's had their colonoscopy, they're getting their 4 bills, their deductible, which can be $5,000 to $10,000. Let's say it's $7,000. How much is that colonoscopy going to cost? Let's say that they had to have a polyp removed, something that's very common during colonoscopies. How much of that is going to go towards deductible?
Almost all of it. Typically, a colonoscopy, especially if it's diagnostic and there's a polyp or two or more involved, you're going to pay. I don't know the exact number, but through insurance you'll typically pay somewhere around $5,500 or $6,500. And again, if you have a deductible that is anywhere near that number, it basically means you are paying the entire cost of that service because you haven't yet met your deductible.
Well, let's use an example where someone has met their deductible. Let's say that their family deductible is set at $7,000. Their kid broke their arm earlier that year. So dad's really excited because his colonoscopy that he needs to get, he's already met the deductible. So he won't get a bill from his colonoscopy, I'm assuming.
Well, again, this is where, again, healthcare gets very complex very quick. If he's going in for what's called a screening colonoscopy under the Affordable Care Act, that's a preventative care service that's supposed to be 100% covered by whatever his insurance carrier is. The problem is if one polyp is found, that flips the coding of the service from a preventative care service. It's now a diagnostic colonoscopy, and so he's on the hook for that amount. Now, in your example, he met his deductible already, but he also hasn't, and this is where we get back into more complication, he has what's called an out-of-pocket maximum that he still has to hit. And so under most insurance plans, he'll have what's called 20%, typically 20% co-insurance that he has to pay. So he's responsible for 20% of the bill, even though he's met his deductible, up to the amount of his max out-of-pocket. And so back to the point we made earlier, this is why people get so confused in healthcare. And again, why we think, you and I both agree on this point, that healthcare is made complex as a feature for insurance, not as a bug. They're not trying to simplify things. They want people to be confused and to throw up their hands and not be able to understand any of the services they're being charged for, the costs of those services, or when the bills start pouring in, how to even ask an intelligent question about any of it.
Yeah. So he's met his deductible. Let's say he goes in and it is a diagnostic. He's now on the hook for 20%. But you were saying earlier that because he used his card with the name brand insurance company on there, he's getting a different price sheet.
Right.
And so his 20% of a procedure, and sometimes there's also co-pays with that, I understand, where you have a $500 co-pay for a surgery, and then you have your co-insurance that you pay 20% up to some stop loss for your policy, I guess.
Right.
So how often is that person who's even met their deductible, how often are they going to be paying much more than what they could have paid if they were given just a cash price for the procedure?
Well, almost 100% of the time. I won't say 100 quite, but almost every time. In fact, I'll back to the colonoscopy example. If you buy a colonoscopy just directly from a surgery center or a surgeon who offers that service and offer to pay a cash price, you'll typically pay something around, call it $2,000 or $2,200. That's the all-inclusive price, and that's whether you have a preventative only service or whether you have what's called a diagnostic, meaning they found a polyp and needed to remove it. And again, if you buy that service through insurance, you're typically going to pay somewhere around $4,500, $5,500, $6,500. Sometimes the number can even be more. And so that's a 50% savings if you just buy it direct and buy it for cash, as opposed to plopping down your insurance card and using your insurance.
So if the consumer wanted to go to a surgery center, they could just walk in the front door and say, I want to buy a colonoscopy.
Yes.
But there there are 4 separate entities involved in that procedure. So how do they then have to they have to then find a surgeon who uses that surgery center, which not all surgeons use all surgery centers.
Correct.
They would then have to go find an anesthesiologist who gives them that price. And then, well, you don't often know whether you need pathology. So can you go to a pathologist and say, I want to buy a polyp analysis? And, because they're going to ask probably, well, how many polyps? How big is the polyp?
Exactly.
So there's a lot of complexity involved in there. So we've got our patient who's now paid their deductibles met. They've now had to pay a copay. A co-insurance comes back. Tell me, what does the experience look like when they go through Fair Market Health? What does Fair Market Health do to solve the problem for the consumer?
Right. So all the complexity that you were just describing, we basically eliminate all of it, right? So instead of because a patient really could do what you just described. They really could go talk to the physician's office, get their price, talk to the facility, get that price. It's possible to do all of that, but nobody wants to do any of that, right? That takes time and effort and probably a little bit of knowledge. Well, we do all that for them. We go talk to the physician, the facility, the anesthesiologist, the lab. We get all of that pricing. And basically what we do at Fair Market Health is we ask the physician, the anesthesiologist, the facility, and the lab for their cash price. We don't care about the insurance price because we know that's overinflated. We say, if we pay you in cash, what price will you give us? That's almost always the best price available. We put all that together in what we call a bundle, right? So it's a bundled service, and we list that bundled price on an online marketplace on the website. And so when you come to Fair Market Health and you type in colonoscopy, up pops all the doctors and all the facilities that offer that service. You click on any one of them, the one nearest to you or with the doctor that you want to pick. You put that in your shopping cart, you click checkout, and that is the price that you pay. It's all been pre-negotiated. It's all known up front. Again, very different than insurance where you're going to get every bill you get through insurance is a surprise bill. Right? You might have known you were getting a bill, but you have no idea what the amount. You're gambling with your finances when you use your insurance card, your good insurance. And so we eliminate all that.
You're writing a blank check almost.
You really are.
Because you can't, how much power do you have to say, I'm not going to pay that?
Correct.
I mean, you've already signed on the line saying that you'll be responsible for whatever payment comes, and you don't know what that payment is going to be. I remember I had a patient who was a cash paying patient. This was probably, 8 or 9 years ago. And they got a bill from the pathologist. It was a $6,000 bill, right? This is the person who's taking the polyp, looking at it under a microscope. And I thought, this has got to be a mistake. There's no way that someone looking at a polyp, this is going to cost $6,000. So we called the pathologist. Well, they had to use a special stain, which they said, this is how much we get paid when we have to use these special techniques. And how are you to know? I mean, at the time of colonoscopy, you have no idea what stain your pathologist is going to use.
Exactly.
I think it's been frustrating because on the physician side, people come back after this experience and they hate it.
Yeah.
So we're creating customers who don't want to come and use the system ever again.
Right.
In one way, which is very different again from most businesses. You think you'd want to make the shopping experience pleasant for your client.
Well, and that's one of the things that is also happening because of the high cost of care is patients are avoiding or entirely avoiding or at best deferring care because they're worried about the cost, and I'd say appropriately assume that it's going to be more money than they want to spend. Again, the unfortunate part is if they use their insurance, that's probably a true statement, right? But if the service is available at a transparent cash price, there's probably a lot of services that people would say, yes, I need that. I will happily pay that, right? I've got assurance this is a price I can pay and afford. But people putting off care and avoiding care entirely, that just makes problems worse. So things get ultimately more expensive because of this. So we've set up this terrible, terrible system where people are not getting the health care they need because of the lack of transparency in price.
Yeah. Yeah, I would say that statement is very true. The longer a health problem goes on, it tends to be, geometric progression in complexity. Yep. I mean, you go from, if someone has a small growth on their lip, it could be something as simple as an in-office biopsy that completely gets all the margins free. You wait a year,
right,
and that thing could have spread to who knows where. And now you're talking extensive surgical resection, plastic surgery to rebuild things,
yep,
chemotherapy, radiation. I mean, you name it, going down the line. And then the care goes through the roof. And so, yeah, I think that's, again, a frustration I have of our current healthcare system. Me being a physician, I see it all the time.
Well, and that's the thing too, is, I had to learn all of this. I knew patients didn't like the insurance system because if you look at scores like Net Promoter Score, right, that says, would you recommend this service or this business to a friend or family member? That is the question that gets asked in Net Promoter Score. And if it's a 10-point scale, and if you answer 9 or 10, you're called a promoter. And if you answer anything 7 or below, you're a detractor. And there's math that gets calculated, promoters versus detractors. Insurance companies have some of the lowest Net Promoter Scores out there. They are on par with companies like cable companies, cellular companies. I mean, you think of the worst companies in terms of people's views of them, insurance companies are right there with them. And so I knew patients hated insurance. I knew employers hated insurance because, the cost goes up every year. What I didn't appreciate fully until I came into this space is how much doctors hate insurance.
Yeah.
Doctors hate insurance, and understandably so. Again, right? They are trying to get paid for the services that they perform for patients and have to fight with insurance companies to really just get paid for the service that they've delivered. And what a frustrating situation to be in.
Yeah. Well, and that speaks very much to personally what happened in my own practice. I recognized this 10 years ago that I didn't want to be working for an insurance company because it felt like I wasn't really working for the patient, because that's not who pays me.
Right.
I always had to, if someone said, can we do this thing? I go, I don't know. I have to check with your insurance first.
Right.
And so I moved into the direct primary care space where prices are transparent. We tell people up front what the costs are. I don't negotiate with insurance companies. And I will say, having done this now, we celebrated 10 years recently.
Nice.
I would never dream of going back.
Right.
I mean, and I look at some of my colleagues who are still in that system and I think, I don't know how you're doing it.
Right. And the statistic that's out right now is physician burnout is hovering around 40 or 50%, which, think of that.
Well, yeah, that's
almost half of doctors
don't want to be doctors.
They're just burned out, and the reason they're burned out is because of all the obligations that are placed on them by insurance companies. Prior auth that you mentioned, doctors don't get paid for doing prior auth, and guess who the patient gets mad at?
The doctor.
The doctor. The doctor has nothing to do, right? The doctor examined you in their professional judgment, made their expert recommendation, but they got to go play Mother May I with the insurance company. By the way, an entity that didn't physically examine you or have anything to do with you. Typically, you're talking to, as a doctor who did examine the patient, you're talking to a specialist who didn't have the expertise that you have. Not only did they not examine the patient, but they don't even specialize in the area that's being discussed, and they're denying care, by the way, without legal liability. The doctor who examined you has legal liability. The insurance company who frequently denies the care has no legal liability in this situation. And the doctor who has to spend hours on the phone and with faxes doing this running around to approve the treatment that they have recommended, they don't get paid for that time. Of course, doctors are frustrated and burned out.
So I don't know if you know this story, but there were two doctors who were at a a CME, Continuing Medical Education Conference, and somewhere in Florida, I think.
Yeah.
So they're one of these large hotels where you've just got endless hallways of conference rooms. They're trying to find their conference room. They walk by an insurance conference that's happening at the same time. And they've gone for a break and they're getting coffee. They're like, yeah, let's pop in here and see what this is about. They sit in the back of this health insurance conference. They are horrified by what they're hearing. So they're discussing this concept of the walkaway rate. And so the insurance company is talking about things like prior auth, automatic denials. So some of the software system automatically denies without even reviewing whether the claim is legitimate. And they're saying that if they can, what they're aiming for is the physician walkaway rate. And what these guys learned, these two doctors learned, was that if they can frustrate you enough, a certain percentage of doctors are just going to go, I'm not going to do the prior auth. And the insurance company can say, well, they didn't, they can go to the patient and go, they didn't do the prior auth, or they didn't do it correctly.
It's the doctor's fault.
Or they didn't use the right code, or it wasn't medically necessary. That's another term that drives me crazy. And I've sat on the phone with these, and you're absolutely right. They're often not a specialist in the area. I remember one particular prior auth is I needed to get someone an advanced cardiac screening, which was a CT coronary angiogram. They're much safer than doing a heart cath. And they're frequently denied by insurance companies. They cost around $2,000 or $3,000 to get. So I told the patient, all right, I'll talk to the insurance company. I think we can make a pretty good case for this because you've got this dyslipidemia and you've got the family history. You're on hypertensive. I mean, you're at high risk. So I get on the call. It's a scheduled call, and of course I can't see the person's face. I don't know who they are other than their name. And I begin laying out my case for them. Well, this guy stops me halfway and he goes, whoa, 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 whoa. He goes, I don't know what you're talking about. I'm a pediatrician.
Right.
And what they tell you is that the insurance company says you're going to have a peer review.
Right.
Which in the insurance company's language means it's an MD or a DO.
Right.
But not a peer.
Right.
So I'm talking to a pediatrician who knows nothing about advanced cardiovascular screening.
Yeah, they're experts at pediatrics.
They're experts in taking care of kiddos who don't have heart attacks generally.
Right.
So I quickly realized, I'm like, why am I having this phone call with you? And he's trying to kind of explain like what the process is. And I quickly realized you're just here to say no.
Yep.
And I think he's just following a script, to be honest.
For sure.
So that was a frustrating experience. And you're right. Now when a patient says to me, hey, can you sign this prior auth for me? Even in the direct primary care space, we still come in contact with this.
Yeah.
My first gut reaction is to go, absolutely not.
And what the insurance company will also be quick to say is, oh, we're not telling you can't have that service.
Right.
We're telling you we're not paying for it, but if your doctor tells you need that service, by all means, pay out of pocket and get that service.
Yeah. Yeah, that's exactly right. But to find out that again, feature, not a bug, they were literally in this conference talking about that they wanted to achieve this certain walkaway rate. And the way they're going to achieve that is just by making the hurdles higher that physicians have to get on the phone and jump through.
And here's the other little dirty secret that I don't think enough people are talking about is United Healthcare is now one of the largest employers of physicians. So the insurance company is now buying up physician practices. So now they're on both sides of the equation, right? Wow. You pay them your premium, and then they can, as part of your network, they can send you to a physician that they own.
How is that not anti-competitive?
It's a great question. Part of the reason this happens is because the antitrust rules have dollar thresholds attached to them. Oh. And so below certain dollar thresholds, companies are kind of free to go acquire whoever they want to acquire. So as long as you're doing a bunch of little transactions, which is exactly what United Healthcare is doing, right. They're just buying up, they're not buying them. There's no $1 billion physician practice for sale. They're all little ish practices.
5 to 6 docs together.
You just buy them, one after the other.
Wow.
And why are these doctors selling out to United Healthcare? Because they're frustrated.
They're fed up.
They're fed up. They are tired of trying to be business owners, trying to get paid from the insurance company. So just imagine the system that's been set up. The insurance companies know, if I frustrate those doctors enough,
I can just come in and buy his practice.
I'll just swoop in and buy them. And in fact, that's one of the things that happened out of the Change Healthcare debacle, right? They got hacked. It shut down all payments to doctors because, again, Change Healthcare is owned by United Healthcare, which many people don't know. United Healthcare, when Change got hacked, was unable to pay all these doctors. Well, a lot of doctors' offices are kind of living hand to mouth, right? They need money coming in to pay all their workers, et cetera. Well, United Healthcare was like, sorry, we got hacked. We can't process any payments. So these doctors were put into a position where United Healthcare basically came in and acquired them because of United Health's screw up.
Talk about evil vertical integration. Holy smokes.
And again, we have a Federal Trade Commission that is supposed to make sure that we've got fair and competitive marketplaces, and for the most part they've been sitting on their hands while all of this has gone on. Change Healthcare, when it was approved or when it was acquired by United Health, it did get reviewed by the FTC, but it was ultimately approved.
Because it's a small dollar amount. There's a bunch of these smaller
Well,
transactions.
they claimed it wouldn't harm competition, and they made whatever arguments they made. It got approved. The acquisition happened, and then it was that acquisition that allowed them through this hack to ultimately go acquire. There's 90,000 doctors. 10% of the doctors in the U.S. actually work as employees for United Healthcare.
And some of them probably don't know that that's actually who they're working for.
That may be true. I don't know that, but that may be true.
Wow. So one thing that we talked about is that there is an effort to make prices transparent. In fact, I remember that Trump got this passed, that health insurance or that I guess it was hospitals and maybe surgery centers were supposed to have transparent pricing in an effort to make a more informed consumer. So where has that gone?
Yeah, so there's really, and this part has been bipartisan for the most part. There was one piece of legislation that's called the No Surprises Act that basically said, hey, if you end up at a hospital and you get a service from a really out-of-network provider, because what happens at a hospital, you're in an semi-emergent or emergent situation. You don't have time to be, verifying, is everybody here in my network? Somebody can walk into your hospital room as a hospitalist, let's say. They could be out, in fact, good chance they are out of your network. And so then you'd get hit with what was then determined to be a surprise bill. Well, the No Surprises Act tried to tamp all of that down. That has been very rough to implement, I'll say. Again, good intent, but the devil is in the details in terms of how those prices all get worked out. So that was one piece of legislation. Overall good, but probably some things that need to be done to further improve it. There was another piece of legislation that said all hospitals have to clearly disclose the prices of their most frequent services. And I think it was a list of like 500 services. For the most part, many of the biggest hospitals do not comply with that law, partly because the fines are a joke, right? If you're $1 billion hospital corporation and you're getting fined $1 a day,
no big deal.
No big deal.
Yeah.
You would rather pay the fine than clearly disclose your prices. And so that's what a lot of the largest hospital systems have done, is they've just chosen, not to comply with the law. More and more hospitals are starting to comply, and I think they're looking at adding some teeth to that law. But again, there's a decent way to go on that. The other piece of legislation that was passed was called the Transparency and Coverage Law, and that basically required insurance carriers to disclose their negotiated prices. Again, it's been slow to be adopted overall, but for the most part, most insurance companies are in fact disclosing most of their prices. Now, a lot of them play a lot of games to put junk data into their public disclosures, and there's a lot of work that needs to be done to unpack all of that and make it more clear. But we are miles ahead of where we used to be from a transparency standpoint. Now I can tell you with a high degree of confidence what is the average insurance rate for a whole host of services, colonoscopies, surgeries of all sorts. Now I have an idea of what is the market negotiated price for that service. And again, that's why I'm always confident to say that the cash price is almost always better than the insurance negotiated price is because I know what the insurance negotiated price is.
Right. I remember when that change first came down, there was a large hospital that released their prices in compliance with the law, but they released it in a proprietary file format.
Right. And
they put it on their website. They said anybody can download this file, but no one could read it.
Right.
And according to the law, they had complied.
Right.
It's not their fault that somebody doesn't have the special software necessary to decode the file.
Right.
So it's amazing the more the government tries to sort of clamp down on something, it feels like it just slips through their fingers like sand.
Yeah.
And the industry is going to just adapt and get around and do end runs and play all
as
these games.
As they say, show me the rule and I'll show you the way around it.
Exactly.
Yeah.
Okay, so we've talked about the frustration that the patient feels. We've talked about the frustration that the doctor feels. Tell me about the frustration that the business owner feels.
Yeah, if you talk to most business leaders, owners, CEOs, CFOs, even heads of HR, again, the theme is frustration. And part of the frustration, I think, is driven by the fact that many people just don't know what to do about the rising cost of healthcare. They feel very helpless. They have the idea that there's nothing they can do. Now, the reality is that's not true. There's actually a lot of very or relatively simple to implement strategies to actually lower the underlying cost of healthcare. But many employers are just, they're in this state of helplessness and they don't really know how to get out of it. And a lot of it has to do with the fact, frankly, with the poor advice they've been given, because there's a whole industry of what's called healthcare consultants out there. And I usually break them into a couple of categories. One category I call brokers, and brokers are people who, for the most part, are paid by the insurance companies.
These are insurance agents?
They're
insurance
agents, right. And they receive most or all of their compensation from the insurance carrier. And what's especially unfortunate about the industry as it currently exists is much of that payment comes under the table. So the employer doesn't actually see all of the compensation that is, the employer thinks that insurance broker is working for them, right? They show up at the meeting and they behave like they're their advisor, but when most of their compensation is actually being paid by the insurance company and most of it under the table, not visible to the employer client, incentives get a little questionable. Now, there's another group of people who work in the health benefit space, and I put them in the category of, true advisors and true consultants, meaning they are truly working in the best interest of their employer clients. And most of those advisors are paid a fixed fee, meaning they don't take any under the table payments or commissions from insurance companies. They are, they disclose, here's what I get paid. I'm working only for you. All of the advice you get from me is without bias and uncompromised, right? I'm going to give you the best advice I know how to give, and I'm not going to let any financial interest from any insurance company or any other vendor, cloud or confuse my judgment.
Which seems to me a better alignment of incentives. And how many, in all the businesses you've worked with, how many businesses actually know that their insurance agent, who they've arguably been using for years, doesn't really try to find them the best price?
At this point, very few. I think it's something that's changing very quickly because, again, back to some of the laws that have been recently passed. One of the laws that got passed was effectively a clarification of what's called the fiduciary duty rule. And this is something that happened in the retirement and 401k space over a decade ago. Well, that rule has now been very clearly applied to the health benefit space. And one of the rules embedded in that is that employers are required to have the compensation of their health plan vendors disclosed to them. So every employer should be reaching out to their broker, advisor, and any other vendors providing services to the health plan and saying, I need to know all of your compensation, both disclosed and previously undisclosed. I need to know every dollar that you are paid related to my account. Many employers don't know that they have that obligation, but many of them are going to find out as soon as a lawsuit gets filed and ask them for that disclosure. In fact, not only are they supposed to have the compensation disclosed to them, they are supposed to make a judgment as to whether it is reasonable or not.
Wow. So these, and oftentimes what happens with these rule changes is it really does take large lawsuits to sort of turn the tide in the industry.
Yep.
And so are there any lawsuits right now that are ongoing that are sort of seen as index lawsuits that maybe then other companies will look at the findings and go, oh, we need to be doing this too?
Yeah, so there's 3 lawsuits that are in play, class action lawsuits that are in play right now. One is against Johnson & Johnson, one is against Wells Fargo, and one is against the Mayo Clinic. All of them basically have this fiduciary rule at the center of it, and basically all of them are health plan members or employees claiming that their employer, Wells Fargo, Mayo, and Johnson & Johnson, did not perform their fiduciary duty. And all of these lawsuits have something in common in that they're all picking on the pharmacy claims. They're picking on what the health plan paid for pharmacy benefits. So, drugs that the plan members were using. And the heart of all of these lawsuits are basically, hey, we know what you paid through the insurance company and through what's called the pharmacy benefit manager. We know the price that was paid, but when we compare it to the price that is available when I just walk into the pharmacy and ask for the cash price, it's thousands or tens of thousands of dollars cheaper. The cash price, again, without insurance, just marching in there as a regular old consumer, is orders of magnitude less than the so-called negotiated rate that the insurance company or the pharmacy benefit manager was able to negotiate. And those employees are looking at that and saying, well, hang on a second, that's not operating as a very good fiduciary looking out for our plan member best interests. Right.
Yeah. I mean, that brings a whole nother discussion we can have on the pharmaceutical industry and the fact that who knows how the prices are set with that. Talk a little bit about what a pharmacy benefit manager, that sounds like a wonderful thing for a plan to have. This can be somebody, I assume, who really helps lower the cost of prescription drugs. Can you talk a little bit about how that is not what a pharmacy benefit manager does?
Yeah, I mean that's the heart of, again, all of these lawsuits is the pharmacy benefit managers, and there's 3 large. They own I think it's 80% of the pharmacy benefit manager market is 3 companies, and those 3 companies are owned by insurance companies. Okay,
so now the insurance companies they're owning physicians.
Yeah.
And now they're owning pharmacy benefit managers, which are essentially setting the prices for the drugs at pharmacies.
Right.
Again, I got to wonder, where is the Department of Justice that goes after these anti-competitive practices?
I think it actually does sit under Department of Justice. I think it's the FTC, the Federal Trade Commission, that polices all of this.
Okay.
And all of these pharmacy benefit managers and insurance company executives, they've all been called into Congress, and Congress wags their finger at them and tells them how evil they are and asks them a bunch of hard questions, but once that's over, they all go back to doing things the exact same way.
Well, and the reality is these insurance companies are writing big checks to those same politicians that are wagging their finger.
Which is a whole separate discussion we could have, because, again, one of the eye-opening learnings that I've had is the insurance, and I'll just say healthcare space or industry generally, they spend more on lobbying than the defense industry. So you think of the Lockheed Martins and all the big companies that are, lobbying our government, trying to get the government to spend more on defense spending. they pale in comparison to what the drug manufacturer, the pharma industry and the American Hospital Association and the insurance companies, they spend orders of magnitude more than the defense industry does in lobbying.
About tax time every year, I start looking at where our tax dollars are going, and it really drives my blood pressure up. It's probably not a great thing for my health. But I was shocked to find out, not only the debt that we're accruing in the United States, it's just mind-boggling. The fact that we're adding, $1 trillion every 90 days. I was shocked to find out that we're spending more on the interest rate on our debt than we do on our military, which is an insane spend for a country.
Yep.
I was even more shocked to find out that chronic care in the United States actually costs 3 times our military budget.
Right. The number in the U.S., and these numbers are so big you can't even really wrap your head around it. But in the U.S. today, we spend $4.5 trillion a year on healthcare. Let that sink in. Per year, right now, healthcare is just shy of 20% of our GDP. 1 in every $5 that we spend in GDP in the U.S. is healthcare.
So I'm a big proponent of a value return. If I'm going to spend money on something, I want value from it. So America is spending, I would say, by far more than any other country on the planet.
And the data bears that out.
Our health outcomes, shockingly, are barely above where Venezuela sits.
Right.
So we're getting third world value from this insane spend.
Yeah, in fact,
on healthcare.
To put numbers to it, the U.S. spends 2x per capita than any other developed country. 2x.
So twice as much as anybody.
Twice as much. And to your point, we have some of the lowest health outcomes out there: maternal health, life expectancy. All the things that you would look at as measures of how are we doing.
Yeah.
And another interesting thing is you'd look at it and assume that, okay, Americans are consuming more healthcare. We actually aren't. By a little bit we do, but for the most part, we don't get more images, more surgeries, more X, Y, or Z. It's back to prices.
Right. Prices
are what drive the 2x spend versus other developed countries and the 4.5 trillion per year that we spend.
I often point out to people, they look at other countries and say we need better health care like those countries, and then they'll say we need health insurance. I think people conflate health care with health insurance.
For sure.
And the reality is we have very good health care in the United States for some things. I've always said, if you're going to have a heart attack, the United States is a great place to have it. You can be in the cath lab,
yep,
a balloon in your artery opening up, life-saving procedure within 30 minutes.
Yep.
Even in the town we're in, you could easily do that. But the healthcare is expensive. Well, let me ask it this way. Is it safe to say that the reason healthcare is so expensive in the United States is because of health insurance?
100%. And this is a statistic that is mind-blowing too. And this gets quoted a lot by Dave Chase, who's a great follow as well, who spent a lot of time in this space studying it. I think the quote that he has is 27 cents of every healthcare dollar is what goes to the healthcare providers.
Yeah.
So invert that, right? The rest of it is not going to healthcare providers. So we have this idea that our high healthcare cost is driven by all this money flowing into healthcare providers. That is 100% false. It's basically a quarter of every dollar we spend is what goes to healthcare providers.
My father sent me a graph that was stunning, and it was basically showed the number of physicians in the U.S. I think this goes back to 1970s up till current, and that growth in physicians. I know exactly
which one you're going to describe.
That growth in physicians about 150%, and so that tracks pretty closely with the growth in population in the United States.
Yeah.
But the line above it is the growth in the administrators in healthcare.
Right.
And that is a 3,000% increase since the 1970s.
Yep.
So that's the 75% that's going to pay essentially for the complexity. So how do we, I think all of the listeners are going to be really frustrated because, and you and I have talked about this a lot, how do we fix this?
Right.
If the complexity is baked in as a feature, the insurance companies are the largest lobby by far. The more administrators you get, the more the healthcare costs rise. The administrators themselves are actually creating the complexity. I would argue both on the physician side and on the insurance company side.
Agreed.
So what are the solutions that the average consumer has that can help them get a hold of this on a personal basis?
Well, I do think, we say frequently cash is king.
Yeah.
I think that's a lot of it is because we talk a lot about how do you become a smart consumer in the healthcare space? Well, a lot of it is just knowing that cash really does drive a lot, or can drive a lot of healthcare consumption. Me personally, and for my family, we buy all of our healthcare using cash. My wife, went through a big cancer journey over the last couple of years. Also, in the middle of it, had an open heart surgery, and we purchased all those services with cash. We don't have traditional insurance. We do something called health cost share, which would probably be a whole separate podcast episode to unpack that. But that's how we protect ourselves against catastrophic loss related to a healthcare claim is a health cost share. But other than that, when we interact with the healthcare system, we're just cash consumers. When we show up and at the doctor's office, and what they'll always say, because we've all experienced this, is, I need your ID and your insurance card. We always respond with, here's our ID. We don't have traditional insurance.
Right.
Again, we have something called the health cost share, but they don't care about that. They just want to know, do you have an insurance card? Because what they're really asking is, hey, if you have one of those, I'm going to be able to overbill you. Uh-huh. We don't play that game. We say, what's your cash price?
Right.
And we are always very pleasantly surprised when they tell us their cash price, and we're happy to pay the cash price. We hand them the credit card and pay it, just like we do when we take our car in for service and it needs an oil change or it needs some work done on the engine. That's what healthcare really needs to look like more, is people need to start asking more for the cash price and stop walking around with that insurance card that they think is a discount card. It is absolutely 100% not.
So I do love the cost sharing programs. Again, because I think the neat thing about them is that when you're paying into your membership for those cost sharing plans, and this was true a few years ago, I don't know if it's still the same, about 90% of the dollars that you pay in actually go to other people who need it to share. So they're able to fund these or to run these plans with 10% overhead, which I'm sure in the insurance company, it's probably the inverse of that, I would imagine. So I talk to patients about these plans, and it scares them because it's not a traditional insurance. It doesn't have the terms like copay, deductible. And they often will say, well, I mean, this sounds great if you need stitches or if you need an x-ray of a bone or a cast, but oh my gosh, what happens if I need open heart surgery or I get cancer? And I now can say to them, how about if you had open heart surgery and cancer?
Yeah.
And you're a great example of two of the worst things you can think of when it comes to the personal healthcare costs that a family could have. You came out ahead. I mean, I think you said you did the analysis on what you would have paid through traditional insurance. In
that 1 year, because both of those events happened to my wife in the same year. In that 1 year, I conservatively saved $30,000. $15,000 because my premiums were so much lower. Yep. And then the other half, because I didn't, under the plan I didn't have the co-insurance obligation. I didn't have to pay that 20% on top. And then couple that with the fact that I was asking for the cash price for everything. People are always surprised, and I tell them all the time. For my wife's open heart surgery, so she had an open heart surgery, 3 days in an ICU bed, and 1 day in a regular hospital bed. So 4 days in the hospital with high intensive care for most of it. And our all-in price for that was $10,000. I had an acquaintance who had open heart surgery a few months before, and I asked him, what was your bill? Because he put down his Blue Cross card, and he's like, I can't remember. He said, I think the last bill I saw was $175,000. Now, again, that's not what he paid.
Right.
I think he maxed out his out-of-pocket max, which was like 10 or 15 grand. But again, he paid more just for his little portion than I paid for the total bill. And I had my health cost share, which kicked in half of that number.
Right.
So my wife got open heart surgery for $5,000.
Well, something else that people don't consider is the deductible that guy would have met gets reset every 12 months.
Another great point.
Right. So had he had this open heart surgery in, let's say, beginning of December, and had his stay gone over, or if he'd had a complication related to that in January, he's going to get hit with another full deductible, correct?
Yep, exactly.
So in the health plan, sharing plan, how does that work?
It's measured on a per event basis. And we got to experience this with my wife's cancer. She started all of her cancer treatment basically in September of one year. She didn't finish her cancer treatment until May of the next year. Under traditional insurance, to your point, we would have had to pay 2 deductibles. Under a health cost share, we paid 1 because it's per event. Right. So really everything that happened from January to May, in fact, she's still actually getting, checkups and other treatments related to her cancer. That's all covered. Yeah. We don't pay any more money because we paid the first time.
The sharing program is picking that up. And that is something that absolutely does not happen in the traditional insurance space. So patients need to be asking for cash prices when they go pick up prescriptions. They need to be asking for what the cash price is when they go in for procedures. Shopping on Fair Market Health is a great way to get all the prices in one for complicated procedures and even simple procedures like you mentioned, healthcare or mental health care.
Well, yeah. Like one of the ones that we see all the time is imaging, CTs, CAT scans, PET scans, MRIs. All those imaging procedures are through insurance. Can be very expensive procedures. If you just buy them directly, or ask for the cash price from the imaging center, it can be half the price or less.
Does Fair Market Health do anything to help people with with medical medicine costs, pharmacy, prescription benefits?
Yeah, we have a program with a company called Dirx, DIRX, and they specialize in generics.
Okay.
And so if anybody happens to take a generic or could take a generic, because there's lots of people who are on a brand name drug that could very easily switch to a equally effective generic, Dirx focuses on generic meds. They do mail order. They even have a kind of a subscription plan so that if I think the cost is like $150 a year, and you can get on their subscription plan, and I think it's a list of like 500 or 1,000 medicines are inside the prescription plan. So, there's lots of ways to, again, be a smart consumer and get the medicines you need as well.
Yeah, it is my first introduction to this was the GoodRx plan. And I think a lot of people now know about it, but I always tell people, look up the prescription on GoodRx. It looks like an insurance card, but I'm assuming it's some kind of a discount card. I don't actually know how GoodRx gets paid. I don't know if you know how they get paid.
I've tried to study it, and honestly, it's so confusing. I'm like, as long as it works,
and it does work.
And it does work.
You can walk in and get something that might be $100 listed price, and you show them the GoodRx card, and you're getting it for $10, which to me just seems crazy.
Yeah.
And what's crazy is Walgreens will have a different price than Dillon's, and then CVS.
And that's the best part with GoodRx is you can look on their app before you go, and you just find whichever location has the lowest price, and you go to that one.
So again, in the interest of trying to empower listeners who are trying to figure out how to navigate this incredibly complex system. And I think we've just touched on the complexity. I mean, it goes layers and layers deeper than this.
For sure.
If they have large like if you need a colonoscopy or something that you can schedule, you should be looking on the marketplace first, asking for cash prices.
Yep.
You should look at your insurance premiums and see if maybe one of these sharing programs would be better off. Who would the sharing program not be good for?
I don't generally recommend sharing programs for people who have employer-sponsored insurance. And the reason I say that is typically your employer is subsidizing a big part of the premium costs. So even though I hate traditional insurance, and I think it could be done so much better, if your employer's going to subsidize, 80, 90% of the cost, it's hard to justify, switching to a health cost share because it incrementally probably will cost you more money. Now, what I'd recommend to people who have traditional insurance through their employer is go have a conversation with the person who manages your benefits, because there's lots of things that can be done. In fact, this is what we do with self-insured employers, is we work with them to help them be smarter and better purchasers of the underlying healthcare costs. Because again, if you buy anything through an insurance network, you're likely overpaying. But if you as an employer can help your employees buy things more directly, and again, that's what we do at Fair Market Health, you're going to save not only on the underlying cost of the service, but that helps lower your insurance premium on a go-forward basis. So you kind of win twice. And again, both as the underlying employee or plan member, but also as the employer who's pumping in a lot of the dollars to subsidize all of this.
So in the employer space, there's sort of three buckets that I would say employers fall into. You've got your small company like ours, where we're just kind of lumped in with a bunch of other companies that are like size. We don't really have any negotiation ability to lower costs. Then you've got on the other end of that spectrum, the very large companies like Koch, who they are truly self-insured, and that all the expenses they have related to healthcare they pay directly. I mean, but they use a Blue Cross Blue Shield to do that. And then there's a middle area where a company might be large enough that they can cover it up to a certain point, but then they have an insurance program that kicks in a stop loss. Am I correct in saying those are the three?
Okay. Yep, you got it. The small end is usually what's called fully insured, meaning they don't really take any risk. They pay their premium and everything's off on the obligation of the insurance company. The insurance company is assuming all the risk. That middle group is what you would call partially self-insured, because they take some risk up to some dollar amount, and then after that they have stop loss to cover it. And then the very largest companies, Kochs and others, they are what's called fully self-insured, meaning they pay truly all the healthcare claims. They have no insurance or stop loss that kicks in. They are 100% on the hook.
So for those companies that are fully self-insured, Koch isn't going out and asking the doctor what the price is. So they're still having to use insurance companies to manage all of that? Yeah,
so because they have employees spread all over the country and frankly the world, but let's stick in the U.S. They use an insurance company to purchase what's the so-called network, right? So they get the card, and so their employees can go to see these doctors. Which again, back to the point we made earlier, you don't really need an insurance company to go to any doctor. In fact, insurance companies are restrictive. And there's some doctors that are in and some doctors that are out. But the reality is you're not getting any special pricing by being in as a consumer or a buyer. So what is the point of the network? But again, we live in this kind of archaic way of thinking that the insurance network matters. So companies still offer the network because I think they treat it a little bit like a safety blanket. They think, oh, because I have a network, I'm offering a real benefit to my employees. But a lot of companies like Koch and the clients that we work with, they have a traditional insurance network, but they also have a service like Fair Market Health. So there's effectively a two-option choice here. You tell your plan members, hey, if you want to use your insurance, you're free to. We're not telling you can't. But if you go to a doctor and you plop down your insurance card, you have a deductible, you might have a co-payment, you probably have co-insurance. All those rules are going to apply. So you're going to have some out-of-pocket obligations. However, if you use fair market health, we'll waive all of your out-of-pocket costs.
Yeah.
So now the employee has a choice. Oh, do I want to go to this doctor and pay something out of pocket, or do I want to just pick one of the fair market health doctors and have my employer pay the entire cost? And why does the employer offer that second option, the fair market health option? Because they know they're paying less overall. So they're happy to pay the employee's portion for them, knowing that the overall cost of the bill is so much less.
Well, and I think there's a third benefit there in that what's the experience like for the patient when they use fair market health? Let's talk about your net promoter score.
Yeah.
How satisfied are people with going through fair market health compared to if they had gone through the traditional insurance? Yeah, what's the difference from the consumer side?
Yeah, my favorite thing in the whole world is reading our customer reviews. It's like I get like I get giddy when I read them because we actually use a 5-star rating system, and our rating is a 4.8 out of 5. And you just read people, and the most common thing that you read from patients is, "I love how easy this is."
Right.
I just love how easy it is.
Yeah.
And that's what we designed it to be, right? We talk about the complexity that exists in the healthcare system. One of our missions is to make it less complex. Let's make this easy, right? I mean, we have the technology. Let's apply technology to make our lives easier. And I talk a lot about how millennials are now the biggest generation in the workforce. They are the largest portion of the workforce. Millennials grew up with technology, right? And Gen Z is coming quickly behind them. And they've never known a world without technology, but millennials had it as they were growing up. And, millennials are accustomed to renting houses online. They order cars through Uber. They buy groceries online. They have food delivered online. Their life is online.
Right.
Except for healthcare.
Yeah.
And millennials at some point, now the biggest portion of the workforce, they're going to be demanding, especially as they come into leadership positions, they're going to start asking, why can't we consume healthcare the same way I operate every other portion of my life?
Yeah. Yeah. It's the next generation will probably be the one to really demand that kind of change.
And I think that generation is here. And again, I think the oldest millennials are in their 40s. So that means they are really officially entering those leadership positions in companies, and they're going to be asking that question.
That's a really good point.
Yeah. All right. Is it 10:50 already?
Yeah.
Oh my gosh. Okay. Do you want to wrap it up? Because I do. Too.
Is there anything that I haven't? Well, I don't want to get into any new topics. So, wow, there's so many more things that I want to cover. So I know we're definitely going to have to come back and have a part 2 of this. But I'm really thankful, not only for your friendship and what you've been to my business personally, but I love the fact that you are a problem solver at heart. And I think what fair market health and what you're doing is solving a monumental problem. It's crazy to me how people don't realize that these solutions are out there and how much money that people can save. So, where can people find out more about you? Do you have a social media presence? If people want to reach out and find out for their company, if we've got CEOs and CFOs listening to this, or HR managers, how do they engage with you? Where do they go to find out about fair market health?
Yeah, you can hit me up on LinkedIn. I post fairly frequently there. Or if you just want to drop me an email, dean@fairmarkethealth.com. Those are the 2 easiest ways to reach me.
Great. Well, thank you again for being a guest on our podcast, and I look forward to future conversations.
Sounds great.